Bismillahirrahmanirrahim. Assalamu alaikum everyone. Myself Dr. Maimuna Azhar. By profession I am a physiotherapist and today I am going to deliver a lecture on the subject of biomechanics and the topic is factors influencing joint flexibility. We have started a topic joint flexibility and in that we have also studied myonic range of motion. So today we are going to cover the factors which are influencing joint flexibility. The number one and most important factor is shape of the bone, and then comes intervening muscles and fat. We have already studied the example of hip joint and shoulder joint in joint stability, as we note that in the acetabular labrum the femoral head comes and fit in the hip joint, and on the other side there comes shoulder joint where glenoid fossa, and in that glenoid fossa our humeral head comes and fit in. So the hip joint where that was more deeper, while the shoulder joint it was not that much deeper, which was going to give less stability and greater flexibility. If we go towards the example of elbow hyperextension, when olecranon of ulna comes in contact with olecranon fossa of humerus in elbow hyperextension, for example this was flexion and this is hyperextension, this bony structure, the shape of the bone does not allow further range of motion. So flexibility is reduced due to shape of the bone. Then we go towards the contrary example of elbow hyperextension. There comes flexion. When we perform elbow flexion, during this motion, as we can see that the further range of motion is being restricted due to this muscle and fat ligament, fat bulk. This muscle and fat bulk is present anteriorly and restricting improved movement interiorly. For most of the individuals, joint flexibility is relative laxity of the muscle crossing through it. Some of the people who do not perform any exercises, their muscles and ligaments and tendons, they are tight. And it is the most common indicator for decreased flexibility. But contrary to that, those people who are performing exercises daily, they are having the better muscles and ligaments, and their joint flexibility is much better than those individuals who are not performing any kind of activities. According to lab studies, extensibility of collagenous tissue is increased when temperature of the area is increased, and it is contrarily decreased when there is cooling effect. So this also show a very distinct effect that with temperature, increase in temperature, joint flexibility is increased, and decrease in temperature, joint flexibility is reduced. And if we directly heat a muscle alone, for example there is a single muscle and we are heating it directly with infrared or hot pack or any other heating modality, and or in combination we are going to do some stretchings, what will happen? It will just stretch that muscle. It will not increase the whole joint flexibility. It will only affect that muscle on which we are trying to perform these heating modalities and stretching techniques. So these are the factors which are actually affecting the joint flexibility. The main one is shape and the other one is muscles and fat. Also temperature is affecting, but joint flexibility is not much affected by direct heating or stretching the muscles. Thank you so much.